Welcome to the VOLVet Voice podcast. We're bringing you the stories of knowledge, compassion, and discovery from the University of Tennessee College of Veterinary Medicine, located on the campus of the UT Institute of Agriculture in Knoxville, Tennessee.
Those cases that, against all odds, go back into the arms of the owners, there's just no better feeling in the whole world, because to that owner, that is their whole world.
Meet Leslie Wereszczak, a licensed veterinary medical technician at the UT College of Veterinary Medicine. In this episode, her fellow technician, Ashley Self, talks to Leslie about the role technicians play as vital members of the veterinary medical team.
Well, welcome everybody. Thanks for joining us. My name is Ashley Self, and I am a licensed veterinary medical technician here at the University of Tennessee. I also have my veterinary technician specialty in nutrition, and so my job here kind of works on the nutrition service. We do a lot of small animal nutrition, and every once in a while dabble in some large animal, but we are here today to kind of talk about veterinary nursing or veterinary technology with Miss Leslie.
Hello, my name is Leslie Wereszczak. I am a licensed veterinary medical technician, and I have my veterinary technician specialty in emergency critical care. And here at the University of Tennessee College of Veterinary Medicine, I am the Director of Emergency Critical Care Services.
Thanks, Leslie. So maybe kind of just to introduce a little bit of veterinary technology or veterinary technicians, can you kind of give us a feel for how this profession kind of started and maybe what it looked like when you first came into veterinary technology?
Well, the veterinary technology profession itself is quite young. We're only about 60 years old as a profession, which is pretty young compared to the human nursing profession. But we've gone through a lot of the same growing pains that they did throughout the years. The profession looks quite similar, but a little bit different since I've been doing this for the past 30 some odd years, in that the roles that veterinary technicians or veterinary nurses undertake are expanding. More responsibility is expected of the veterinary nurses, and their knowledge base needs to be much broader, and the responsibilities that they undertake have expanded a great deal. So I feel like there's still a long way to go because there's not a lot of recognition for our profession, say like a human RN. So when you say that you're an RN, that education and schooling and knowledge and experience is implied, whereas a veterinary technician, that is not the same for us. And so we end up explaining a lot what we do, and I don't think the public is truly aware of what our roles are. And so we need to change that. We certainly need to bring a little bit more recognition to our profession.
Yeah, so if we kind of look at and take a step towards, okay, so what is, how do you become a veterinary technician? What does it take, or what does the schooling look like to kind of set you up to start a career in becoming a veterinary technician? Sure.
So a veterinary technician degree is really quite parallel to a human nursing degree. In fact, if you look at the two curriculums side by side, they're very similar in nature in terms of the courses that you take. There's just species differerences, obviously, in that we take care of animals and RNs take care of people. And so there's a 2-year degree path, an associate's degree path, just as there is in human nursing, and then there's a bachelor's degree path, just as there is in human nursing. And there's different schools that, from community colleges all the way up to larger universities, that offer the veterinary nursing or veterinary technology degrees. And so that's the path that you have to take. So you in many states, not in all states, and that's certainly something we're working for, but in the state of Tennessee, of course, you do have to be a graduate of an AVMA accredited veterinary technology program and passed the national board exam, which is the veterinary technician national exam, and in order to get your license to practice as a veterinary technician in the state of Tennessee. Not all states are like that, but we're working towards that. And so that's kind of the path of becoming a veterinary technician.
So it sounds like you have the option to do an associate's degree, you have the option to do a bachelor's degree, and then everybody takes the same kind of licensing exam, if you will.
Correct.
And then differences can exist amongst the states. So how do you classify, or what are the credentials that can maybe change between Tennessee and Illinois or Florida? Just because if I'm an owner and I walk into a clinic and maybe I see, Ashley Self CVT, or, I travel between Illinois and Florida, and when I'm in Florida, I take my pet and I see a different credentialing. Maybe I see Ashley Self LVMT. Are there differences for me as an owner that I need to take into account when I'm seeing different credentials after somebody's name as a veterinary technician?
That's one of the challenges we face as a profession, is that we are the same veterinary technicians, yet we have different credentials throughout the 50 United States. And there are a few states, there's only 4 or 5 now, but that don't credential their technicians. They don't recognize them. Veterinary technicians aren't governed by their state practice acts that govern veterinarians. And so in the United States, there are 4 different credentials. There's registered veterinary technician, or RVT, licensed veterinary technician, LVT, certified veterinary technician, or CVT, and then state of Tennessee is actually the only state that is an LVMT, and we're licensed veterinary medical technicians. In terms of scope of practice, there are a few states that define scope of practice in that what that veterinary technician is allowed to do legally. However, we all do practice under the direct supervision of a veterinarian, and there are 3 things that we aren't allowed to do. We aren't allowed to do surgery, we aren't allowed to diagnose, and we're not allowed to prescribe medication to owners. The veterinarian has to do those things. And so, and then in some states they define that a 4th thing that is not allowed by veterinary technicians that must be done by the veterinarian, and that is prognose. So outside of those 3 or 4 things, that is what we cannot do. So the other skills that are needed to care for sick, ill, injured, or well animals are definitely under the umbrella of being allowed for veterinary technicians to do.
Okay. So yeah, regardless of the credential that you see, you can kind of think of them or look at maybe some of their responsibilities similar to what a human nursing would be performing. So placing catheters, drawing blood, kind of monitoring the patient under anesthesia. Do you have any other kind of thoughts or comments on things that you might see a veterinary nurse be involved in, at least in maybe a general practice right now? We can kind of get into more specialty in a couple minutes, but kind of what's your take, or how can you speak to veterinary technicians that an owner may see at their well-being appointments?
Well, I think that the owner should recognize that this veterinary technician that's taking the pet's initial history and doing a physical exam has an education behind the questions that they're asking, and there's a reason behind those questions. There's a science behind those questions and an understanding by that individual, who is then going to collaborate with the veterinarian and together as a team come up with the best wellness plan for that pet. Through that kind of questioning and investigative questioning, that technician can get an understanding of the pet's home environment, of their lifestyle, their diet, what things they might be exposed to in their daily lives, if they're a pet that stays inside most of the time, or are they out hiking in the mountains? And that could determine whether or not we're recommending certain vaccines or certain preventative care options for that pet. So I think it's kind of the same situation, if you go to your family doctor or an internal medicine specialist, or if you go to the pediatrician, those nurses have specific skill sets specific to those types of practices that treat those types of people. So you don't usually have a nurse that's working in a pediatrician's office that has been working in surgery their whole life. They're pediatric nurses. This is what their specialty is. This is what their interest is in. And so they have a skill set in that specific area. And it's the same thing for us as well.
Yeah, so I think you bring up a really good point in that not only do we kind of have this veterinary technician that can kind of learn and do all things, but then we also have opportunities to really specialize in areas that really interest us and to kind of advance particular skills that maybe are a more natural fit for us. So can you speak to kind of what opportunities there are for different specialties for veterinary technicians?
There's quite a few, actually, and we add more as time goes on. The oldest one is my specialty in emergency critical care. That was the first specialty that was recognized. And then there's different avenues you can go down if you have an interest in, say, anesthesia or surgery. In internal medicine, there's subcategories for that, like cardiology, and neurology has a specialty. There's large animal specialties. Of course, your specialty in nutrition, physical rehabilitation, dermatology, ophthalmology, all kind. I know I'm leaving many of them out. So there's all kinds of opportunities for you to, after you've had a specific number of years of experience in that particular area, where you're working really exclusively within that area, then you can start doing case reports, getting your skills checklist checked off, getting letters of recommendation, and then taking a very rigorous exam and passing, hopefully, and that you become a veterinary technician specialist in that area.
And so that's generally maybe a 3 to 5 year process for most veterinary technicians, or how kind of timeline wise do you think?
Each academy has their own minimum number of years of experience or hours of experience that add up to the number of years, and it varies from 3 to 5 years generally of immersive practice within that specialty. So say for me, I worked in emergency critical care. If I do anesthesia occasionally, I'm not qualified to take the anesthesia specialty. Most of what I do is in emergency critical care. So you have to be immersed within that area to get your specialist in that particular area.
Yeah, I think that's great. And, if we kind of took a minute and said, okay, can you, as a veterinary technician that has their specialty in emergency and critical care, can you give us like a snapshot of what maybe your day or responsibilities could look like? And maybe it's a little challenging based on what's here, but I think it would be really fun to kind of just get a peek view of what a veterinary nurse or veterinary technician with your specialty would be able to do.
Sure. I think it opens up opportunities for you to take care of the most critical patients, the most involved patients. And I'm speaking along the lines of my particular specialty, but it's different for each specialty. But it gives, for me, I have a better understanding to care for the most critically ill or injured patients. I can assist the veterinarian in administering the care for that patient. I can also teach younger technicians. For us here at the university, I am able to teach students, even interns and house officers that are just starting their journey along their path of their specialty. I think teaching is huge because you have that depth of understanding and your ability to just kind of expand on what you're doing, and why you're doing what you're doing. We can teach people skills. Anybody can be taught to draw blood or put in catheters or even do some of the advanced level math that we're doing for the drugs. But knowing the pathophysiology behind it gives me a better understanding to be able to then teach that to students and to house officers and to fellow technicians, so that the standard of care, it elevates the level of care that we're able to provide. And that's why we're a specialty center, because people here are specialists in their particular area.
And I think you've kind of spoken to it a little bit just in kind of a roundabout way in terms of why having a licensed veterinary technician as a part of your practice can really elevate your practice. But is there anything else that you can share with us in terms of why having licensed veterinary technicians or even veterinary technician specialties that can just really empower your practice, and how using them can really make a more efficient and well-versed practice?
Sure. Well, I think anytime you have that level of education in your nursing staff, it elevates your level of practice. And a veterinary technician, a licensed veterinary technician, or I guess I should say a credentialed veterinary technician, since we're licensed, but there's certified, there's registered veterinary technicians. But there have been studies done that shows that if every licensed veterinary technician increases the efficiency of the practice profoundly, because if that technician's skills are truly utilized, they are the one that is drawing the blood, running the blood samples, looking at the CBC, doing the differential, if they are the ones that are taking the radiographs. Now, even more so, technicians are getting into doing ultrasounds, just as they do in human medicine. That increases your efficiency in your practice and allows you to actually be able to see more patients in your practice. So from a economic perspective, you are able to increase revenue in your practice. And that is not why we're in practice, certainly. But of course, we have to keep the lights on as well. So one of the things that is tends to be a negative for veterinary technicians is the pay scale. And so practices that utilize their veterinary technicians well are able to pay them what they are worth because they're able to increase revenue in their practice. It gives the technician job satisfaction, and it provides better care for that patient.
Yeah, I think those are all really great points, and definitely helpful to just kind of go back and look at how can we support our veterinary technicians in practice, and I think some of it is getting around to what are they capable of doing, what do they enjoy doing, and how can we best utilize the skill set of veterinary technicians. In terms of kind of looking in the future, because we've talked a little bit about where we are now, but looking forward, what would you kind of like to see come about in the professional aspect for veterinary technicians, and what do you kind of see or desire for the future?
I think we need to keep working on technician utilization, teaching veterinarians what our role is, because honestly, it's kind of ironically that I don't think a lot of veterinarians do understand what we learn in our college programs, what skills really should be delegated to the veterinary technicians, and allow the doctors to be doing the diagnosing, doing the surgery, critically thinking about the case, and then having us carry out the treatment plan. And I think we have been fighting this battle my entire profession of proper technician utilization, and we still have a long way to come. But I think that has to start within the DVM education and teach technician utilization right within the DVM curriculum, so that veterinarians graduate from their veterinary program knowing what a veterinary technician should and can be doing. I don't think that there's that much ambiguity between an MD's education and a nursing degree. I think that when MDs come out of medical school, they recognize they're going to be doing things that are supposed to be done specifically by an MD, and that the nurses are going to carry out the treatment plan. And we have a great shortage of veterinarians in this country. We have a great shortage of veterinary technicians in this country too. And the pet owning public is going to feel that squeeze and their inability to find care for their pets. And so I think by just out of necessity, are probably going to have to see technicians utilized more so that veterinarians are able to reach more pets. I think it has to happen that way. Otherwise, there's going to be a lot of pets that go without care.
And a little bit of maybe like a side question, but speaking to appropriate utilization, if there are veterinary technicians listening to this talk and maybe they have been trying to have a little bit more of a voice or kind of a working relationship with their veterinarian, and maybe they're trying to change some of their responsibilities, what's kind of your advice if you kind of spoke directly to the veterinary technicians in terms of how can you professionally advocate for yourself, maybe not only to pet owners, but also to the veterinarians?
I just spoke about this actually to some veterinary technician students who I really want to give them a foundation to start right off the bat advocating for themselves and kind of demanding to do what they have been trained to do. And so I think that veterinary technicians should feel empowered to go to their veterinarians and have a very professional conversation with what roles they feel like they can do, what skills they know they have and want to expand upon, and perhaps talk about it in a manner of how that's ultimately going to elevate the level of practice within that practice and help more pets and help provide better care for every patient that comes into that practice. If I've said this to veterinary technician students all the time, if you find yourself that you are the one that's holding the animal for everything for the veterinarian to perform all these procedures on, then you need to have that conversation with that veterinarian. And if that doesn't change, then likely you are in the wrong practice. Because I think that if, and I've said this to the students recently, the veterinary technician students recently, that if this is what happens, this type of underutilization is often what causes technicians to leave the field because they don't feel fulfilled. They don't feel that they're a part of the medical team. They don't. Their professional curiosity isn't being satisfied at all. And so, if they find themselves trying to change that and it won't change, don't change professions. Change the practice you're in. There are many technicians out there who do feel fulfilled, who are utilized in practices that are very eager to take them on, very eager to pay them well, very eager to utilize them to the fullest, and find those practices because you'll have much better job satisfaction and you're helping pets more.
Yeah. And in terms of kind of thinking about here at UT and maybe the advantage in a sense that we have as veterinary technicians, because we do get to work with kind of all levels of veterinary care, if you will, and veterinary students that are soon to be graduating veterinarians. How, in our kind of daily practice with them, what's your advice, or maybe what do you see in how we're able to, as veterinary technicians, integrate our skill to the veterinary students to kind of show them, hey, these are kind of tasks that we can do and these are tasks that we can help you with. Just how do you see that relationship interacting here within the school with veterinary technicians and maybe soon to be veterinarians?
I think, Ashley, that we do that very well in our clinic. I think that our students are keenly aware of how skilled our technicians are within the clinic. I think, though, that it's a model that it's not what they're going to find in a lot of the practice situations that when they leave here and go out into practice and they suddenly find that they have veterinary assistants who don't have as much experience and may not have the advanced knowledge. It's not being critical at all, but I think that they understand that in their clinical education, at least they experience it. I don't think necessarily that they understand that we have 80 some odd credentialed technicians in this hospital that are part of their clinical education. And I think that that message needs to be delivered in their first, second, and third year when they're in the classroom, and that they understand that there needs to be this very synergistic relationship with their nursing staff when they graduate, and perhaps incorporate that in a business model as well, and teach them that yes, you are a veterinarian as a doctor, but you're not going to get the same salary as an MD. Of course, just as veterinary technicians are not going to get the same salaries as RNs. We understand that, and we all go into this profession for different reasons. Yet, if they recognize that the revenue that they are able to generate in their practices is going to go significantly higher if they utilize their credentialed veterinary technicians, and they start telling them that early, then I think they're going to understand the importance of the relationship and embrace it a little bit more.
And I think the other kind of fun way to kind of look at things or think about things is we've kind of talked about, going and being able to speak with the veterinarian about what your desired job responsibilities could be as a veterinary nurse. But what, for you personally, because this answer probably varies among veterinary technicians, but for you personally, what makes you as a veterinary technician want to walk through fire, if you will, for your veterinarian? Like when you are picking the prized veterinarian to work with as a veterinary nurse, what qualities or things really make you feel so committed to that veterinarian and what they're asking you to do?
I think that's why I've been here for 32 years. I mean, because I have worked with veterinarians who I don't feel like I'm working for them, that I'm working with them. That's a relationship that we develop, and that we're a team. I know the team thing is used so much, and it's a little bit of a cliche, but honestly, when the veterinarians that I have worked with here truly listen to my opinion, they ask me what my opinion is. They take my observations and my comments seriously and aren't dismissive about them. They've made me feel an integral part of each patient's healthcare team. And they tell me that. They tell me how appreciated my observations are, my skills, those types of things. And I feel appreciated. There's nothing that makes somebody more dissatisfied in their job than to not feel appreciated. And so when you have a veterinarian that you respect so much because of their skill and their knowledge, that treats you like you are an extension of them and that they can't do their job without you, you're willing to walk through fire for those people.
Yeah. And
you understand that their expertise and your contributions to that make a significant difference in people's pets. And there's just no better feeling in the whole world when you know that you contributed to that. Of course, the veterinarian is at the top of the pyramid of this,
Yeah.
But
I think it really fuels you as a veterinary nurse too.
Absolutely, it does.
Really kind of makes you want to get up every day and do your job, and you enjoy what you're doing. And when they're challenging you as a veterinary nurse,
yes,
it speaks volumes.
It does.
Kind of two last things here, but if we ended with, if you were speaking to the veterinary technician population, what is kind of your advice for them? Or if you could give them some coaching comments, what's your best kind of supportive comments for our group of veterinary technicians?
Be involved. Advocate for your profession. Don't expect that this is all going to be done for you. Join your state technician association, and not just join, be involved. Become an officer. Attend the meetings, those types of things, and talk about the issues that matter to you, and because they matter to everyone. And that's first and foremost. Join your national association, because by joining NAVTA, again, we need many voices to be the catalyst for change within our profession. Early on in my career, I thought we'd be a little bit further along than we are after 30 some odd years in terms of technician recognition and utilization and licensure. And still, there are still practices where everybody's a technician, whether or not they're credentialed or not. And those things need to change. And the only way those are going to change is if the veterinary technicians who are credentialed are involved in their profession. And when you feel like, you're burning out, you reinvent yourself. There's so many different ways to reinvent yourself in this profession that will, rekindle that spark. I use this analogy, like if you had a wound, you wouldn't just let it keep bleeding. So stop the bleeding, stop your burnout, and reinvent yourself. Make yourself heal and move on to a different way in which you can be impactful within the profession. But we need really bright advocates in this profession to stay in the profession and drive it forward.
Those are great. Thank you kind of for giving us the good vibes and the good pushes on kind of your insight for us and coaching. And then, of course, just ending on why you love veterinary medicine. What gets you up to do veterinary medicine and work as a veterinary technician daily?
I had somebody ask me the other day, if you had to do this over again, would you do it? And the answer is yes, I would. I really have thoroughly enjoyed this profession. I get frustrated when people say, well, did you want to go to vet school? Or, or why didn't you go to vet school? Or do you want to go to vet school? Those types of things. No, I wanted to be a veterinary technician. It is really hard. Some days it's very, very hard. It's sad. There's a lot of loss. There's a lot of sadness. But there is a lot of victories, and there's a lot of warm fuzzy in this profession. And for me, being at an academic institution, I love to teach. I love to see students inspired and just kind of, just get so excited about something when they see something for the first time, or they get a skill for the first time, and you've been part of that teaching process. That keeps me going. Those cases that, against all odds, go back into the arms of the owners, there's just no better feeling in the whole world, because to that owner, that is their whole world. And you were a part of that, being able to reunite that pet with their owner. I'm getting choked up about it right now. I mean, it's a great feeling when you win. You don't always win.
Yep.
But you do win a lot, and that's what it's all about.
Well, Leslie, you have been a total joy today, and I just want to thank you so much for taking time out of your day and just talking veterinary technicians and kind of the daily life and what it can look like for us in the future. And thank you just for all you do for our profession and where you have helped get us to.
Thank you. This was fun.
If you'd like more information about the UT Veterinary College, you can visit vetmed.tennessee.edu. And if you'd like to learn more about becoming a veterinary technician or being more involved as a veterinary technician, you can visit nafta.org.
Thank you for joining us for this episode of VOLVet Voice, a podcast that shares the stories of knowledge, compassion, and discovery that help create real-life solutions at the University of Tennessee College of Veterinary Medicine in Knoxville, Tennessee.